Hi, I'm Martha Slay. Welcome to the Fight SMA special, Fighting Back, presented by our true partners in the fight, Metro Productions. Today we're very excited to have with us two special guests, Dr. Robert Leshner from Children's National Medical Center and Dr. MacKenzie from Children's Hospital of Eastern Ontario. We're going to be looking today at some questions that are on the mind of the SMA community, most especially parents of our very special children fighting SMA. One question has to do with exercise, and this is something that is very important to the life and well-being of SMA children. But it's a sensitive issue, and so we have a question coming to us really in three parts. So from a parent, what is too little exercise? What constitutes too much exercise? And is it even possible to even injure oneself through excessive exercise?
This is a question I'm asked almost on a daily basis. And unfortunately, we don't have an answer based on scientific evidence or appropriate clinical trials. And so the answer I give to parents is based on a gut feeling and a teeny bit of common sense. Too little exercise is not allowing your child to do everything within the range of that child's ability. Too much exercise, I think, is exercising to the point of fatigue, exhaustion, or pain. I think in the situation we have with SMA kids who are already having their motor units working overtime, that pushing to the point of muscle breakdown or fatigue is a clue that you've done too much. Now the question is, can you over-exercise to the point of causing further damage? And I don't think we know the answer to that. But if we use the analog of a post-polio syndrome, theoretically excessive exercise done repetitively could be hurtful. What I recommend as a compromise is a swimming program done 3 or 4 times weekly, if at all possible, where I think a youngster can get a decent aerobic workout without any risk of high-impact injury, orthopedic injury, and exercise to the point where they can really easily titrate the length, the duration, and the intensity of that exercise program. Not an easy thing for every family to access, but if I had my way, there'd be a swimming pool in everybody's backyard.
I have to agree with you completely. A question crossed my mind as you were speaking. I wonder, maybe Alec, you'd like to speak to this, or you too, Bob. Do you see that it's possible for an SMA patient, an SMA child, to actually build their stamina and work towards an increase of stamina and strength? Can strength actually be built and increased through exercise?
Interesting. I think the idea of building strength, it's an intriguing one notionally. I think the end game with exercise is, if I can get a bit technical, preservation of the synapses, the junction between the actual motor neuron and the muscle itself. And Bob speaks with years of wisdom and insight. I, as a pediatrician, but one who is more involved in research, can cite the work out of France studying the mice with type 2 SMA, which they placed on the exercise wheel. And then they did electrophysiologic studies, and they showed that mice that were exercised quite vigorously, remembering this is mice, not humans, really showed preservation of these so-called synapses, the neuromuscular junction. So I think the community has swung around to the idea in the last 5 or 10 that some exercise, as Bob says, is good. And there's some preliminary mouse data showing that this really may preserve these so-called neuromuscular junctions. As far as actually increasing stamina, possibly as well. No evidence at this stage. Bob, would you agree?
No, I agree fully. And I would give the caution that exercising a muscle which is already quite weak is probably not a good idea. At least what we've learned from other neuromuscular disorders is that maintaining the elements of the neuromuscular systems, the muscle groups which are more powerful, is met with increased endurance and at least a small increase in objective strength measurements.
Oh, excellent. And then again, with your comment on water.
Never get enough water.
Yeah, excellent. Okay, well, that's a good word. Another question that we have today has to do with actually the diagnosis. So a question from a parent then is, what constitutes a definitive diagnosis for SMA? Alec, you want to take?
Well, I mean, this SMA is one of those fairly rare genetic disorders where it really does seem very clean that for the classical diagnosis of spinal muscular atrophy, really the mutation or deletion of both copies of SMN1 is what they call a sine qua non, something that's pretty essential. Now, Bob, I'm sure you'll point out that there's these so-called phenocopies where there's these minority of children that really look like SMA in whom they don't have these mutations. And that's a whole other topic I'm sure you'd like to touch upon. But for most of them, we have the luxury of being able to do a genetic diagnosis. And there are a number of labs, both in the US and Canada, that can get this done. Bob?
No, I fully agree. I will give
A caveat?
a caveat. Again, everything which is SMA by clinical criteria, by electrodiagnostic criteria, and there are barbaric people such as myself who stick pins into muscles and give electrical shocks to poor young children to establish a diagnosis of a neurogenic disorder. There are disorders other than 5q SMA which can produce a virtually identical phenotype. And I'll give one other caveat, having been burned twice in my career. When a child has come in with a molecular genetic diagnosis of spinal muscular atrophy and a clinical picture which didn't look anything like SMA, that repeating the DNA test showed that the child did not have SMA to start with. So I think that all of us who practice clinical medicine insist that a clinical picture must be consistent to be entirely happy with that diagnosis.
A good old-fashioned guy, and I think totally appropriately so. So in that case, the actual DNA test turned out around to be misleading.
The DNA test gave an erroneous value,
So
yes,
in the minority of cases, but it can happen.
Very, very unusual, but always questioned.
Yep, good for you.
Thank you. A mom has written who has an infant child who's just been diagnosed with SMA. She wonders, should she have her 7- and 8-year-old children also tested?
That's a tough question, but I have a fairly stock answer that I give to parents who wonder if their older children are at risk of expressing clinical SMA. It's possible, and there are rare cases where one member of a family has early onset typical type 1 SMA, and other siblings have a more benign variant. However, this is very uncommon. And what I would suggest is if mom is really concerned, would be simply to have the children carefully examined either by their pediatrician or by a neuromuscular consult. And if there is no evidence of any malfunction, strength, endurance is normal, I would not do DNA testing.
There's that old-fashioned guy again, but I have to agree, absolutely right. I mean, we live in an age when people love the idea of genetic diagnosis, DNA testing, but I think this is totally the appropriate approach. First, treat the patient, investigate the patient, and I couldn't agree more with this approach.
But there probably are parents who wonder if their children are carriers. So,
yeah, I mean, that's almost a different question, and one that, there is a really what amounts to, I guess, a 50% chance that a sibling of a child with SMA will be a carrier. And sure, that can be tested. I would say, at the risk of sounding possibly patronizing, I hope not, but this would occasion and enhance some sort of worry on the part of the parents. So
I agree.
I don't know, Bob, what are your thoughts?
Well, I think having dealt with large families, I believe in the autonomy of children as young as 7 or 8. And I think that given the fact that the real reason you're testing for the carrier state is not for the child himself, but for their children. I leave that to the discretion of the children when they reach the age of my majority. And then if they wish to be tested.
The question at that time.
That's right. I don't want to have the child come to adolescence feeling as if I am damaged goods. I want them to be mature enough to be able to handle the information, positive or negative.
Right. I consider this excellent counsel, and I'm sure you will too. Thanks so much for joining in today, and we hope that you'll come back again and visit us at Fighting Back. And also, between now and then, if you have questions, we hope that you'll go to www.fightsma.org and send those questions in. We'll do our very best to answer them. Thank you again for joining.